Welcome to the Aesthetic Doctor. I'm Sarah, and today we're discussing an important topic with Dr. Rogier Meulenaar about body image and aesthetic treatments. Dr. Meulenaar, this is something that affects many people considering aesthetic treatments, isn't it?
Absolutely, Sarah. What many people don't realize is that beauty isn't just about what we see in the mirror. It's deeply connected to how we feel about ourselves. Today, I want to talk about something that's rarely discussed in aesthetic medicine, the relationship between our self-perception and aesthetic treatments.
Why is this such an important topic to discuss?
In my practice, I often see patients who are focused on what they perceive as flaws that others can barely notice. It's crucial to understand that sometimes what we see in the mirror isn't necessarily what others see. This understanding shapes how I approach consultations and treatment recommendations.
Can you give us an example of how this plays out in your practice?
Of course, recently I had a consultation with a patient, let's call her Emma, who came in requesting multiple treatments. What struck me wasn't her appearance, but how she described herself. While she was focusing on minute details, what she really needed wasn't more treatments, but a different perspective on beauty and self acceptance.
That must be a delicate conversation to have with patients.
It is, and it's one of the most important parts of my job. As aesthetic physicians, we have an ethical responsibility to understand not just the physical aspects of treatment, but also the psychological motivations behind them. Sometimes saying no to treatment is the most caring thing we can do.
You mentioned social media's impact. Can you share some specific examples you've seen in your practice?
I had a really interesting case recently. A 23-year-old patient came in with a filtered photo from Instagram showing completely unrealistic lip proportions. When I showed her the mathematical proportions of natural beautiful lips using the phi ratio, she was fascinated. It completely changed her perspective.
Can you explain what you mean by these natural proportions?
Of course, there's actually a fascinating science behind facial aesthetics. For example, in naturally beautiful lips, the lower lip is typically 1.6 times the size of the upper lip. But what many people don't realize is that changing one feature affects your entire facial harmony.
And what role does social media play in all of this?
Social media has dramatically changed how people view themselves. We're constantly exposed to filtered and edited images that aren't realistic. In my practice at Practique for Injectables, we focus on educating patients about natural beauty and realistic expectations. It's about enhancement, not transformation.
We actually have Dr. Emma Vanderberg, a clinical psychologist, joining us by phone. Dr. Vanderberg, what's your perspective on this intersection between aesthetics and psychology?
What's crucial to understand is that body dysmorphic disorder affects about 2% of the general population, but this number jumps to nearly 13% in aesthetic clinics. These aren't just statistics, these are people struggling with real pain.
That's exactly why screening is so crucial in our practice. Can you share some of the warning signs we should look for?
Absolutely. We typically look for patterns like excessive mirror checking, constant comparison with others, seeking repeated reassurance, extreme anxiety about minor or non existent flaws, social withdrawal due to appearance concerns.
What advice would you give to someone who's considering aesthetic treatments?
First, reflect on your motivations. Are you doing this for yourself or because of external pressures? Second, be wary of seeking perfection. It doesn't exist. And finally, choose a practitioner who takes time to understand your goals and isn't afraid to have honest conversations about what's appropriate and what isn't.
It sounds like you take a very holistic approach to treatment.
Yes, because true beauty isn't just about physical appearance. At our clinic, we believe in creating changes that enhance natural beauty while ensuring patients feel confident and comfortable in their own skin. Sometimes the smallest changes can make the biggest difference in how someone feels about themselves.
What practical advice would you give to our listeners who might be concerned about these issues?
I'll share what I call the 3 EP reality check. Take a social media break for 1 week and notice how you feel. Ask 3 trusted friends what they actually notice about your appearance. Write down your motivations for wanting a treatment and review them after 2 weeks. What's fascinating is that patients who follow these steps often come back with completely different perspectives.
We actually asked our listeners to send in questions before the show. Here's one from Lisa. How do you handle it when a friend or family member might be showing signs of body dysmorphia?
That's an excellent question, Lisa. The key is to approach the conversation with empathy. Rather than directly addressing their appearance concerns, Focus on expressing care about their overall well being. You might say something like, I notice you seem preoccupied lately and I care about how you're feeling.
That's a great approach. It's also important to understand that someone with body dysmorphic concerns often feels very isolated. Suggesting professional help needs to be done carefully.
Exactly. In my practice, I often see patients who were encouraged to seek help by caring friends or family. The most effective approach is to share resources and information, rather than trying to convince someone their concerns aren't valid. Their feelings are very real to them.
Do you have another question from our listeners?
Yes, here's an interesting one from Mark. How can you tell the difference between wanting to improve your appearance and having an unhealthy fixation?
That's a crucial distinction. The key difference is how these thoughts impact your daily life. If concerns about appearance are interfering with your work, relationships, or ability to enjoy life, that's a red flag.
I completely agree. It's perfectly normal to want to enhance your appearance. The concern arises when these thoughts become obsessive or when someone believes a cosmetic procedure will completely transform their life or solve all their problems.
Before we wrap up, what would you say to someone who might be struggling with their self image?
I would say that you're not alone, and it's okay to seek help, whether that's talking to a mental health professional or having an honest conversation with an aesthetic physician who prioritizes your well being. At Praktijk voor Injectables, we believe in creating a safe space for these conversations.
Thank you, Dr. Meulenaar and Dr. Vanderberg, for this insightful discussion. For our listeners who want to learn more or schedule a consultation, where can they find you?
You can visit our website at praktijkvoorinjectables.nl, where we share educational content about our approach to natural looking results. We believe in transparent communication and creating a comfortable environment for all our patients.
Thank you for joining us today on The Aesthetic Doctor. Join us next time when we'll be discussing another fascinating topic in aesthetic medicine.